HIV. Since the disease was first discovered in the early 80s, until today, the best practices for healthcare professionals have been evolving. At the same time, our understanding of HIV and our capacity to adequately treat and prevent it have steadily improved. But one thing hasn't changed. The AIDS Education and Training Center program has been a steady force, working for positive change in the battle against HIV in the United States. Supported by the Health Resources and Services Administration HIV/AIDS Bureau, through the Ryan White Comprehensive AIDS Resources Emergency Act, and now the Ryan White HIV/AIDS Program. The AETC program has helped healthcare providers implement evidence-based HIV care and treatment interventions since 1987. Today, as the AETC program turns 35, we reflect on past milestones, celebrate the work done, and prepare for the challenges ahead. In 1987, the AETC program was formed with 4 regional centers to provide training and technical assistance to HIV healthcare providers on HIV prevention, diagnosis, treatment, and palliative care. In the early 90s, HIV infections were spreading rapidly, as was panic and misinformation. As media campaigns worked to inform the public, the AETC program was charged with ensuring that healthcare providers stayed up to date with the treatment recommendations. By 1991, the AETC program had expanded to 11 regional centers and covered all U.S. states and territories. In 1993, a clinician-to-clinician HIV warm line was established at San Francisco General Hospital to answer healthcare provider questions quickly. This eventually became the AETC National Clinician Consultation Center. In 1995, the highest number of HIV-related deaths occurred in the United States. However, things were about to change. Powerful treatment strategies based on AIDS clinical trials were being employed. The focus became prevention of HIV perinatal transmission, prevention and treatment of opportunistic infections and cancers, and treatment using combined antiretroviral medications, which expanded in 1996 and was then referred to as HAART. By the mid-90s, Black Americans accounted for the highest number of people with HIV by racial ethnic identity. As a result, the Federal Minority AIDS Initiative was started in 1998 to improve HIV care access for disproportionately affected racial ethnic populations. This initiative influenced the work of the AETC program. From 1999 to 2000, the AETC program expanded to include 4 national centers: the National Resource Center, the National Evaluation Center, the National Minority AETC, and the National Clinician Consultation Center. By 2002, 2/3 of new infections came from people who didn't know they were HIV positive. The AETC program updated their program to support the push for more testing. At this time, the AETC program expanded to 14 regional centers. In 2005, the U.S.-Mexico border AETC steering team, UMBAST, was established to address HIV-related care issues among immigrants in the southwestern U.S. In 2006, the AETC program reinforced the CDC's revised HIV testing recommendations nationally. By 2010, treatments had improved and hope emerged that HIV was now a chronic and not necessarily a terminal illness. But with a decrease in HIV providers, the AETC program expanded to include HIV training programs for new physicians, nurse practitioners, and physician assistants. The National Minority AETC became the National Multicultural Center, and a 5th national center, the National Center for HIV Care in Minority Communities, was added. Breakthroughs continued, and pre-exposure prophylaxis, PrEP, became an option for HIV prevention and a new training topic for the AETC program. By 2011, 9 AETC telehealth training programs were added to support low-volume primary care providers and multidisciplinary clinical teams in rural settings. In 2015, the AETC program condensed into 8 regional and 2 national centers, and the National Resource Center became the National Coordinating Resource Center. In 2017, the AETC program launched the first free online national HIV curriculum, presenting guidelines and tools in easy, self-directed ways. In the same year, the AETC program launched a national HIV/HCV co-infection curriculum to assist providers in preventing and curing HCV infection among people with HIV. Today, the AETC program is actively working on the national strategy to end the HIV epidemic while responding to the COVID-19 pandemic. For 35 years, as the HIV epidemic has transformed and changed, so too has the AETC program. To ensure that healthcare professionals nationwide have the tools they need to provide evidence-based, high-quality care to all people with or at risk of HIV. We all imagine a day when the fight against HIV is finally over. Until that day arrives, we will be advocating, educating, consulting, and coaching. That is our mission and our passion.